Today I'm down in Reading to see Dr. Bob Khanna, which is very exciting because he is an expert clinician with a global reputation stretching back 25 years or more in aesthetics. So I've come to have a chat with him to talk about his latest work and to see what he's up to. So come on in with me and come and meet him. Bob, you are an expert practitioner with a global reputation. You know, I've seen you lecturing on stages, teaching people around the world for like 20 years or more. So in all this time as a leader in this field, what have you learned?
Oh, that's very kind of you to say so, Alice, I have to say. Well, I would say I think it's very important for any clinician not to become complacent in any way. Quite frankly, you're only as good as your last case, your last patient case.
Now, you also still teach a lot of the time, don't you? I mean, we are sitting in your training institute and you're leading the training for people from beginners through to experts. So what is it that makes teaching and training such an important thing for you?
I think because it means that I never get the opportunity to rest on my laurels. And like I said to you, complacency is a bad thing. Yeah. And I think it's a constant reminder to me to be innovative, be open-minded, be broad-minded in my approach, and always trying to better myself and better my techniques and concepts so that the end user, i.e. the patient, is benefited in an even better way than before. So that's one of the benefits of teaching. It keeps me on my toes, it makes me want to be even better. And you know, I would like to think that certainly 25 years later, I'm a far better clinician than I was 25 years ago. And that's only a good thing, so it's a positive thing.
Good, and your teaching style is quite nice and light. I mean, obviously it's very serious, but you've got quite a nice jokey manner. I mean, I know it was the very end of the session I caught, but you keep everybody's attention like that. I mean, you've got a nice small group. Is this the way you always teach?
I think, you know, one of the things that I found very important is not to lose your own personality, not to try and be something that you're not. So I can't help myself, but my personality, however good or bad, will come out in my teaching. And I found that works. So I don't take myself too seriously. I'm very self-critical and quite happy to, you know, for people to challenge me, and I invite that. I think that's very important. And I've always said there's no such thing as a bad student, just bad teachers.
I mean, you do end up sorting out the complications caused by a lot of other practitioners, don't you?
Well, it's a sad indictment of our industry, unfortunately, because we have so many people getting involved in facial aesthetics. What it means is that, you know, not everybody is trained to the right level to appreciate the underlying anatomy well and the variations of anatomy, and also management of complications and addressing them in a timely fashion. And certainly on my courses, I empower all my delegates to actually learn how to spot the signs of problems early and deal with these things in a timely fashion. I would like to see, of course, more regulation in this industry. I'd like to see more attention to detail. I'd like to see more clinicians being more versed with regard to the underlying anatomy and importantly, how to address certain key complications themselves. The good news is at least there are people like myself who can manage these complications. The bad news is we really shouldn't see the sort of numbers that we are seeing, and unfortunately I receive probably 10 or 12 referrals a week for complications.
So there are half a dozen treatment rooms all along here, so let's come and have a little look in this one where we've got hydrofacial over here. This is the mechanized deep cleansing facial. Sounds a bit like a car wash, but it's really good. I know Bob always says every patient has to have one of these before treatment, because why would you wax a car if it's filthy underneath? So this gets out all the dirt. Then we've got lasers over here. This is the Harmony Clear Lift laser. It's really good for brightening up the complexion. The Soprano, this is the one that everybody knows from hair removal because it's the least painful hair removal laser, and it's pretty fast too. Okay, in here, we've got cool sculpting in here, which is this huge machine, very popular form of fat freezing, cryolipolysis. I know in your work you are constantly innovating, and you've got a terrific procedure that you're going to show later today, which is, how do we describe this? It's got 3 technologies all bundled into one.
So essentially what I've done is I've harnessed the benefits of all of these wonderful procedures, which are of course very evidence-based. You've got radiofrequency microneedling, you've got PRP, and of course thread lifting.
Sure.
And in their own way, they have an important role in stimulating collagen. And the wonderful thing is that we are able to produce such wonderful results by actually combining those treatments together all in one session. The result is of course beautifully tightened skin, which of course, let's be honest, who doesn't want tight skin?
No, everybody wants that. And this is a lower face thing, is it?
It's full face. It's actually the full face, yeah.
Wow.
By tightening the full face, that's of course the upper, mid and the lower face, you're effectively able to redefine that jawline and redrape the jawline to bring about a more youthful and more defined appearance.
In a non-surgical way.
Absolutely.
Now, as if you weren't busy enough already, you've got your own skincare line. It's been endorsed by dermatologists and doctors. Question is, Bob, do you actually use it yourself? Are you good with skincare?
Yes, I absolutely do. I do.
Maybe you're going to surprise me by saying no.
I have to say it's probably the one thing that I do keep up. Skincare is vitally important, and the older we get, the more important it is, I suppose. I mean, you're looking at 51-year-old skin right now, at the end of a very hard day, I have to say.
And what are the basics for you? Cleanser, vitamin C?
Yeah, so within my system, I have a comprehensive system, a day and night system. So everything you really need from a maintenance point of view. So proper glycolic cleanser with the right percentages and the right sort of penetration values. Vitamin C, high strength vitamin C, easily absorbed, and glycolic and hyaluronic acid serums. And then of course, vitally important is a decent SPF. Factor 50. My particular SPF is that it doesn't leave you with this sort of zinky, chalky white appearance. And then in the evening, then I'm a big fan of the right type of retinol without causing too much dryness, and obviously a locking in moisturizer for nighttime use only.
So I know you started out in dentistry and you still do some advanced dental procedures, don't you? But could you talk a bit about why it's really important to consider, you know, the jaw and the dentition when you're looking at facial aesthetics?
Well, look, you know, if the eyes are the windows to the soul, then the mouth is the voice of the soul, and then the face is the home of beauty. So what I'm really getting at is that you can't ignore a very important part of the aesthetic ideal. And if we take the view that when you meet somebody on a regular basis or for the first time, your focus will be on their eyes and their mouth, purely from a communication point of view.
Because that's where, if you track eye movements, that's where they go.
Exactly. So as a dentist, it's fundamentally important to make sure that their teeth are healthy, and of course, being very involved in cosmetic dentistry, it's important to make sure that the teeth look good and aesthetic, as an important part of the smile. So I'm very involved in implantology, placement, and also bone reconstruction to facilitate implants, and do big mouth rehabs, as well as of course veneers and crowns to help teeth look as good as they can be. And the important thing is, from an aging point of view, when you lose teeth and as you age, this affects the surrounding bone, and that in itself will actually cause a collapse of the skin and the fat and the muscles around the oral cavity. So somebody can age dramatically by what's happening internally in their teeth.
For sure, it all starts to kind of collapse in, doesn't it?
Absolutely. Yeah.
Now, what is Prophylloplasty? It's all about the profile, isn't it? Because I know this is a concept you've been innovating, you've been talking on it all around the world. In fact, weren't you talking about this in Monaco?
I was indeed,
Yeah.
and at CCR too. So this is a concept really that I've been heavily involved with, encouraging all practitioners, clinicians around the world to really look at the bigger picture, the macroscopic environment of the face in 3 dimensions. So Prophylloplasty allows the clinician to have a very good idea and handle on the way the forehead, the nose, the lips, the chin, and of course the neck sit together.
Okay.
It's
lovely.
all about the synergy
Sure.
of these vital parts of the face, as opposed to isolating your treatment and your thought processes to one particular area of the face. And so what I've done is I've effectively created strategies and algorithms for clinicians to be able to manage all aspects of the face, so that the profile can be enhanced and not violated in any way, which is of course to be avoided, and made things a lot simpler for clinicians to be able to achieve the best outcomes.
Okay, how fascinating, because there is a lot of focus on the jaw at the moment, or the chin, and then if you don't watch it, you end up with a slightly unharmonious set of features if you haven't been thinking about this whole thing of the profile.
That's right. And also, can I add that it's very important for you to have a handle on the difference between females and males.
Sure.
Because a female's profile, if we want to sort of look at feminizing a female, is very different to a male profile if we look at ideal norms. And of course there's variations within those, but we do need to understand there are fundamental differences, so-called sexual dimorphism between the males and females. And what I've done is
like the strong jaw versus
exactly
the pointy chin.
Width, length, projection of the chin, for example, the definition of the jawline must be different for females and males.
One stat that always impresses me about your work is that over 40% of your patients are in fact practitioners themselves. So you really are the doctor's doctor, aren't you?
I'm very fortunate, very privileged to be chosen by many practitioners all around the world to have their own treatments. But of course, that comes with its own challenges, of course, and I do enjoy that challenge because, of course, their understanding is at a much higher level and they're very appreciative. So I'm very happy about that. What I'm doing here is effectively providing a very efficient radio frequency current to the collagen that's contained within the skin and of course the fat. And what that will do is remodel the collagen as well as stimulate the fibroblasts. Okay, we are done. Beautifully tight this area has become now. A little bit of redness, which is good. We want that. We want this redness. That's exactly what we want. We want that blood supply in that area, ready for what's to come. So I'm just withdrawing the plasma and the red blood cells are left behind, as you can see there. So the idea here is to make sure that the threads are in the actual right plane. They need to be in the subdermal plane. They need to be harnessed within the fat itself. And then what I'm going to do now is just gently place a little bit of plasma, like so.
Wow, so each thread has a dose of plasma along the length of that injection.
Exactly. So essentially what I've got here is platelet-rich plasma harnessed along the thread in exactly the same plane. So I've got essential growth factors right in the heart of the business area. Wow. So I've got traction, I've got growth factors, I'm going to get increased blood supply, angiogenesis, and I'm also get obviously the benefits of the radio frequency that have with the pre-treatment. So we're really getting a phenomenal amount of treatment in this area, which will then continue the collagen stimulation throughout. You can see this beautiful jawline now, nice and smooth, no lumps, no bumps, no creping of the tissue, just beautiful, harmonious skin.
So that was quite something, that procedure, wasn't it? I mean, putting 3 technologies together in one procedure, it gives a lovely initial result, as you can see, and I know that's something that will develop well over time. So I hope you enjoyed it and meeting Dr. Bob Khanna, and thank you very much for watching.